Hello and welcome. Do you have lower back pain and hardness in bending, extending, especially from standing up or sitting down? Then this video is definitely for you. I already done a video in this series, and this is the continuation of how to deal with problems and pain, especially chronic pain from injuries, spinal surgeries, all these kind of gruesome events that can happen to our spines. And you've probably been to lots of doctors, chiropractors, and people saying, well, you have to live with this, there's nothing you can do. That's not really true. I'm not saying you can restore your full mobility to the way it was before, but you might be able to do just that. You might even be more limber after than you were before the injury. It all comes down to how you treat your spine, how you work with your belief system, and finding ways to move without pain. And if there is pain, learning how to deal with the emotional response and the tightness of the muscles that happens whenever you feel or experience this pain. So in this video, I'm going to show you a range of exercises that you can do to help you slowly produce some circulation and do some movements that will help to restore the lower back mobility. And we're going to go through the hip, because when the hip is stuck, most of the back is also going to be very stuck and stiff. We're not going to be able to walk properly, sit down, stand up. So through the hip, we're going to be able to get into the lower back pains. And we had countless of clients that we worked with that had lower back pain. People coming fresh out of surgeries. I myself have had a lot of lower back pain that I worked with throughout the years. And there is really a lot of benefits to be done by addressing the different areas, the actual pain, the nutrition, doing the correct movements, and working with the emotional responses, and also being able to relax the muscles around the area enough so we can start to restore the movements and find our way back into natural movements. So if you like this video, please like and subscribe to our YouTube channel, and you're going to get a lot more material. We also have free ebooks on some topics through nutrition, detox. And if you would like further support, we have free consultations, and you can reach us at support@livingwiththespirit.com, or you can go to livingwiththespirit.com webpage and you can book a free consultation, no strings attached, and we just have a chat and see what we can do for you. And we also have online programs and in-house programs if you want to work further with us. And we also have an online health club with master classes where you can work in your own pace from the comfort of your home, going through each series of exercises and learning how to sequence them into your lifestyle to produce health in your lower back and to get rid of chronic pain for good. Okay, so this exercise we will use TRX band or ring rows as a support. So basically bring them to a very low setting, about mid-shin level, and then we want to interlace them, meaning they go into each other at least 2 times. So if I pull in one end, the other one doesn't go anywhere. Bring it down, make sure they're all the way down. Something to hold on to, doesn't have to be parallels, can be a wall, a chair, another person, whatever's helping you. Place your foot all the way through, so it's in the middle of your foot. And then you're going to find the distance. Now we're going to work with the back of this thigh and the front of this thigh, and we're going to start to open up the hip and lower back in this area. So I come up on my toe, tuck my pelvis in, glide forward, use this leg and this leg to come back. So I go back, forth. Good thing to do is raise your gaze. If you look down, your whole body's going to go like this. So keep your head up, straight position in your back, and we go back and forth. If it's too heavy, you just stand a little bit closer. So you're going to feel it here, and you might feel it here as well. Okay, so about 10 times or a minute on each side. And you switch legs. Beware, it can be a difference right from left side. And then you come back. Okay, so in this video we're gonna work with the SI joint. So at the bottom of our sacrum, of our spine, there is a bone called sacrum. It's like a fist. And next to the bone we have like the intestine bones, and they look like the ears of an elephant. So in between this area there's a little movement, and that's the SI joint. So the way we're going to do is going to find something that is about mid-thigh level, depending on your flexibility. And I want to be working on my left side. So I'm going to place my left foot up on this object. I'm going to bring my butt back, and the weight goes through this heel, and I'm working on this side. Now you can use a weight for some extra support here. And what you want to do is lean forward and kind of do a slight rotation, that you kind of just drop this shoulder down and then pull it back up. You can support here if you need to, you can support here, or just hold here. If it's too heavy with a weight, you can just start from here, kind of hands here, down here, and then gradually sliding down. And we want to open up this area about 10 times or a minute. You can gently come all the way up, support if you need, bring the leg down, shake out a little bit, and then we do the same thing for the other side. So place the foot flat, bring the butt back, this hand, this leg, and it works together. So a little bit of a rotation, leaning down. So we're going to continue to work with the lower back now. We're going to work with the hips, but a little bit more towards the lower back. Now, if this was the movement that was the problem, we're not going to go straight into that movement. We're actually going to go through working sideways with the lateral flexion, that the spine can work in this area. So it can be a pillar, it can be a wall. What we want to do is place the hand slightly below your shoulder level, because if it's too high, you're going to feel tension here. So kind of below your chest level, and you have a little bit of support. You come away from the pillar, place your hands on your hip. What you're going to do is going to drop your hip in and then kind of come up. Now what this will do is will help to restore the balance in your lower back, in your vertebrae, especially if there is one side that's a little bit tighter than another. So you do 10 times on one side, and after that you bring this leg out, hands in the back of your spine, like if you had back pockets, and do a very gently back bend for 10 times. You can keep your hip still, and then you can shake out, and you can do the same thing for the other side. So hands on the hip, drop the hip in towards the side about 10 times. After 10 times you come parallel, hands in on your imaginary back pockets, and we do some slight back bends just to introduce some slight movement into the lower back. So you can do this daily. Good to do in the morning and very good to do in the evening. Try it for a few weeks, and you can always write us if you have any questions or how to do it specifically for you, or if it's a good fit or not. Okay, so in this sequence we're going to work with the hip rotation, the hip range of movement. And it can be a little bit tricky sometimes. What's the lower back? What's the hip? What's me leaning sideways in my spine? So I'm going to help you to find a way that you can optimize the mobility into your hip. So for the sake of balance, let's hold on to something. You can either stand like this or like this. It's up to you. So what we want to do is we want to work with the hip joint. And to access the hip joint, we're going to imagine that there's a straight line from your hip all the way to your knee. So what I do with the lower leg doesn't matter. What I do with this one is what matters. So you're going to bend your knee. You can hold your hand here on the side. You're going to bring it up to about 90 degrees. Bring it out to the side. Now, I don't want to start to rotate my spine or working on this hip. I'm focusing on this hip. So this one stays forward. From here, I'm going to bring the foot up and then continue the knee course around. What's easy to do when you do this movement is you start to arch your back. So we try not to do that to the best of our capabilities. Of course, you're going to arch a little bit because it can be very hard to only work with the hip. But we want to be able to strive to do this movement with as little movement in the spine for right now. And once it feels okay, you can add a little bit more spine movement into it. And then we can go the other way around. So back, open up, and we come back. So you can do 10 times on one side and then 10 times on the other side. You can do it in the mornings and in the evenings. And it's a really good practice to do for a couple of weeks to kind of start to introduce some mobility in the hips. So after you've done this for about 2-3 weeks, you're going to start to feel a lot of benefits. And then you can move on to the next video that I will post in a little bit. Thank you very much for listening, and if you like this video, please like and subscribe our YouTube channel, and you're going to get a lot more materials. We have free books, we have consultations if you want to talk to us directly and see if there's something we can help you with to give you some resources that you can continue to explore on your own. We also have a lot of packages if you want to work with pain and emotional regulation and stress. And we also have an online health club where it's a lot of master classes that you can work from the comfort of your own home and take the pre-recorded videos step by step and the material to create your own program and work from where you're at. So thank you very much for listening, and I look forward to see you soon.